Hello everyone.
Especially to our dear Professor, Ma'am Nerissa and Beatriz.
We are from Pamukid Elementary School.
I am Teacher Bell,
Teacher Asiel.
And Teacher Shi, and we are about to report
Administration and Interpretation of Psychological Tests.
To start our discussion, what is psychological testing? Or what is a psychological test? It is an objective and a standardized measure of sample of behavior. It is a standardized measure quantitatively or qualitatively one or more than one aspect of a trait by means of a sample of verbal or non-verbal behaviors. So the main purpose of psychological testing is to gain a better understanding of a person and her or his behavior. The goal of psychological assessment are to better understand the person's strengths and weaknesses, identify potential problems with cognitions, emotional reactivity, and make recommendations for treatment or remediation. All types of psychological evaluations measure an individual's functioning at a specific point in time and provide a snapshot of a person. Almost all psychological testing is administered by a licensed psychologist or trainee and is a formal process that requires extensive training and expertise. Psychologists are only professionals that are expertly trained in administering and interpreting psychological tests. Psychological testing is not one single test, but a series of scientifically developed tests and procedures that assess various aspects of a person's psychological functioning. Types of tests and procedures includes interviews, unstructured or semi-structured conversation with a client, caregivers, teachers, and other individuals familiar to the client. Interviews allows observation of social, language, and communication skills. Norm reference measures. These are tests that are standardized over clearly defined groups with representative characteristics of age, gender, ethnicity, socioeconomic status, or other features. These tests allow us to compare the client we are assessing with a broader normal group. An example, comparing this teenager with the other average teenager. Behavioral observations. Observing the client's behavior during the assessment and when possible in his or her natural environment such as the classroom, home, playground, etc. Informal adjustment procedures. These adjuncts supply supplementary information to support formal test procedures and may include things such as school records, standardized test scores, SAT or ACT, medical records, and formal background questionnaires, and personal documents. Who can administer psychological testing? So, sino ba ang maaaring mga siwa ng psychological testing? Formal psychological testing is conducted by licensed clinical psychologists, typically within one of 3 specialties. So, ang makakapangasiwa lamang ng psychological testing ay yung mga may lisensya, yung mga professional psychologists. So, dapat meron silang 1 specialties sa mga sumusunod na ito. So, for number 1 is school psychologist. This psychologist focused on the developmental processes of youth primarily in the context of the school and family system. Number 2, clinical psychologist. Considered the generalist of psychology specialties. These individuals functions in many capacities such as mental health providers, assessors, consultants, educators, or researchers. Number 3, clinical neuropsychologist, a specialty within psychology that focuses on understanding brain behavior, relationship. So, dapat yung professional na mag-a-administer or mangangasiwa ng psychological testing ay isa sa mga specialty niya ay isa dito sa tatlong ito, yung school psychologist, clinical psychologist, and clinical neuropsychologist.
Okay, so what are the different types of psychological testing? So the number 1 is psychoeducational assessment. So these evaluations are typically performed by school psychologists or other learning specialists who often work directly in the school setting. Yung mga nandun lang po sa school, ano po? So, psychoeducational assessment is these evaluations include formal assessments of a child, intelligence, and academic skills para malaman ng psychologist kung ano po yung mga intelligence and academic skills ng bata. Ano po? Para ma-determine din kung bakit yung bata nag-struggle inside the classroom setting. Ano po? Para malaman natin kung ano yung kailangan niyang i-develop or kailangan niyang intervention para doon po sa bata. The next one is psychological assessment. What is psychological assessment? These evaluations are typically performed by clinical psychologists in school, hospital, outpatient, or other settings. So, this one naman, ano po? So, the goal of this evaluation is typically to clarify diagnosis and inform treatment intervention or ito naman ang kailangan lang talaga nito, ang goal nito ay para malaman kung or kailangan niyang i-clarify, malaman ano ba yung na-diagnose doon sa patient or the client. Ano po? Ano ba ang kailangan niyang treatment or ano ba ang kailangan niyang i-undergo na intervention. Because depending on the scope of the evaluation, the time and cost involved can vary greatly. Ano po, para malaman din kung hanggang kailan ang intervention na gagawin, hanggang kailan yung treatment na gagawin, para naman yung costing. Ano po, syempre yung patient or ng client natin, kasi kadalasan ang iniisip ay yung pera. Ano po, yung mag-undergo ka ng intervention, kailangan mayroon kang pera. And then, the next one is neuropsychological assessment. This is the most specialized type of assessment. These evaluations are performed by neuropsychologists. Ano po? So, ito yung mga pinagdadaanan ng mga bagong hire sa DepEd. Ano po? We are going to neuropsychologists para magpa-test din po tayo. Ano po? So, neuropsychological assessment is to um, assess, typically evaluate, and great detail things as a memory. Ano po? So, yan yung tinetest ng neuropsychologist. Ano po? Yung, yung regarding sa functioning ng ating brain. Ano po? Yung detalye ng ating memory, attention, information processing, sensory perception, language, fine motor skills, visual spatial skills, and other neurocognitive processes, and provide recommendation for remediating any identified deficits. Ano po? So, para malaman natin kung kailangan ba ng client or ng patient na mag-undergo ng intervention or kaya ng remediating. Ano po? So, what is the psychological test interpretation? So, ano naman paano kaya ang pag-interpret ng psychological test? Ano po? So, psychological tests, self-administered tests are self-administered in the sense that very little interaction occurs between the examiner and the client. Ano po? Para malaman talaga, it is the interaction between the examiner and the client. In general, clients do not require direct supervision while they are completing the task. But, first, the test must be completed in secure setting. No one else can provide answers to item in person. Ano po? No one else can provide. Walang magpo-provide doon po sa client. By text or by email, and clients cannot take the materials out of the secure setting. So, walang dala. Ano po? The second one is someone must be available to monitor test security. Okay, so the third one is instruction must be read to the client or provided in the standard fashion. So, syempre, kailangan the instruction is clear to the client. And test forms must be reviewed for completeness. O, kailangan po na check ng maigi yung kung kompleto ba yung answer, ay yung questionnaire bago ibigay sa client. Ano po? So, the next one is, for some tests, answer sheets must be collected after certain time intervals. If the tests are administered in the same way, they were administered to be normative samples. Then, standard interpretative statements are applicable. So, we have personality test. So, MMPI-3, the Minnesota Multiphasic Personality Inventory 3, MMPI-3, is an empirically based assessment of adult psychopathology used by clinicians to assist with the diagnosis and treatment of mental disorder. So, the test items with true or false is 335 items. Yung age range is 18 years and older. Reading level is 4.5 grade. Admin time is 35 to 50 minutes. The norms is a nationally representative community sample of adult. Men and women is 810 men and 800 women between the ages of 18 to 80 from several regions and diverse communities within the U.S. The next one is MMPI-2-RF. So, composed of 338 items with the RC. So, RC is restructured clinical skills at its core. The MMPI-2-RF is linked to current models of psychopathology and personality. So, they have 338 true or false items. Age range is 18 years and older. Reading level is 4.5 grade. The admin time is 35 to 50 minutes. The norms of it is the MMPI-2-RF. Normative sample is drawn from the MMPI-2 normative sample and consists of 2,276 men and women between the ages 18 and 80 from several regions, diverse communities, and the US. So we have personality assessment inventory, or the PAI. So the 344 PAI items constitute with 22 non-overlapping scales covering the constructs of most relevant to a broad-based assessment of mental disorders. 4 validity scales, 11 clinical scales, 5 treatment scales, and 2 interpersonal scales. So the age range is 18 to 89 years. Admin time is 50 to 60 minutes. The norms of it is reliability and validity are based on data from a US Census match normative sample of 1,000 community dwelling adults, a sample of 1,265 patients from 69 clinical sites, and a college sample of 1,051 students.
So let us proceed now to the health inventory. Battery for Health Improvement 2, or the BHI-2, is a 217-item multiple choice questionnaire that provides assessment of physical symptoms and psychological, character, environment, and social factors that can impact response to normal course of treatment and recovery of patients being treated for pain and injury. Assessment of validity of response is provided. So the age range for this health inventory is 18 to 65 years old, and the administration time is only 30 minutes. So dito sa inventory na ito, kailangan within 30 minutes masagot natin yung assessment na 217 multiple choice questionnaire. So let us proceed now to the post-traumatic stress disorder assessments. Trauma Symptom Inventory 2, or the TSI-2. A broadband measure, the TSI-2 is designed to evaluate post-traumatic stress and other psychological sequelae of traumatic events, including the effects of sexual and physical assault, intimate partner violence, combat, torture, motor vehicle accidents, mass casualty events, medical trauma, traumatic losses, and childhood abuse or neglect. So the age range for this inventory is 18 to 88 years old. The administration time is for only 20 minutes. The norms is the validation sample consisted of 5 non-overlapping clinical groups, combat veterans, individuals with borderline personality disorder, sexual abuse victims, victims of domestic violence, and incarcerated women. A sample of subjects simulating PTSD was used to test malingering. And for our next slide, the detailed assessment, post-traumatic stress, or the DAPS. A 104-item measure, the DAPS generates a tentative diagnosis of post-traumatic stress disorder, or the PTSD, or acute stress disorder in considerably less time than is required for a structured diagnostic interview. This diagnosis can then be confirmed by a clinical interview. So the age range for DAPS is 18 to 91 years old. The administration time is 20 to 30 minutes. The norms is the trauma-exposed adults from the general population, as well as the two validity samples, trauma-exposed adults in a clinical community sample and a university validity sample. So let us proceed now to the cognitive and executive functioning, Reynolds Adaptable Intelligence Test or the RATE. So sa test na ito, ito yung tinatawag na a time test na later, I will discuss kung gaano katagal yung isang part ng test and the other part is have only for only minutes. So the RATE is a rapid, reliable, and valid intelligence test designed for group or individual administration, composed of 7 subtests that assess crystallized intelligence, fluid intelligence, and quantitative aptitude or intelligence. Designed to provide continuity of measurement across a wide age span, requires minimal reading skill and almost no motor coordination and visual skill, reducing the complication that can occur when manipulated objects, the example is just like the blocks, are used to assess intelligence. So sa test na ito, they are using yung blocks, as I mentioned a while ago, para ma-assess nila yung intelligence ng isang magpapatest. So the RATE or the Reynolds Adaptable Intelligence Test, na kung saan ito yung mabilis at validong pag-test natin sa kaalaman ng isang tao. So the age range for this is that 10 to 75 years old. Yung administration time, 50 minutes for full battery, 30 minutes for crystallized and fluid subtest only. So the norms for this test, they standardized on a 2010 census matched sample of 2,124 individuals. So dito sa oras na ito, yung isang part ng test, kailangan makumpleto within 30 minutes lang. And yung isang part is kailangan nating makumpleto within 20 minutes. So yung test na ito ay kailangan na-mention dito yung rapid, yung mabilis. So next to our slide is the behavior rating inventory of executive function, the adult version or the brief A. The brief A is a standardized measure that captures views of an adult's executive functions or self-regulation in his or her everyday environment. Both of self-report and an informant report are used. The brief A is composed of 75 items within 9 non-overlapping theoretically and empirically derived clinical scales: inhibit, self-monitor, plan, organize, shift, initiate, task monitor, emotional control, working memory, and organization of materials. So the age range for this adult version is 18 to 90 years old. The administration time is 10 to 15 minutes. So the normative sample included 1,136 adults from a wide range of racial, ethnic backgrounds, educational backgrounds, and geographic regions. Profiles for diagnostic groups including ADHD, Alzheimer's disease, and multiple sclerosis are presented. And down to our last slide for this topic, the FAIN Cognitive Impairment Validity Indicator Profile or the BIP, designed to help meet the increasing need for a well-validated psychometrically sound test that can provide empirical support in courtrooms and other legal instructions. The BIP test provides a broad spectrum of information about an individual's performance on an assessment battery. So the age range for this Cognitive impairment for individuals is 18 to 69 years old. The reading level should be varies. The administration time, the verbal subtest is 20 minutes for 78 items only. The nonverbal subtest is 30 minutes for 100 items. Yan, so let us remember that psychological testing is, the goals are to better understand the person's strengths or weaknesses and identify potential problems with cognition, emotional reactivity, and make recommendations or treatment. Na kung saan yung test na ito is to know our intelligence, is also our weaknesses, yung mga kainan or mga kalakasan natin. And before we end this topic for this day, according to B.F. Skinner, that a failure is not always a mistake. It may simply be the best one can do under the circumstances. The real mistake is to stop trying. Yan. So, kailangan go lang tayo. Though, as a person, syempre, makakagawa talaga tayo ng mga mistake. But, let us recognize na yung mistake na nagagawa natin, pwede natin siyang gawin as to motivate ourselves na mas mapabuti pa ang ating sarili. Let us not stop in trying. Good day, everyone. That's all for today. Thank you.